Okay, so I'm going to overview the pain gate theory. I'm an acupuncturist, so I found this really fascinating to actually learn about. Surprisingly, I didn't in acupuncture school, specifically what happens with our nervous system in regards to pain. So really generally what it is the body has two sets of nerves that go from our body to our brain to alert us of different sensations, including pain. Generally, pain travels on the smaller nerve fibers, and other movement, temperature, touch, pressure travels on the larger nerve fibers. And so this pain goes on the smaller ones, also slower. And the other movement nerve fibers travel on the larger ones and faster. So if you're experiencing pain, but then also experience touch or rubbing or temperature at the site of the injury, that sensation will actually travel faster and reach the brain before the pain, and will close off the gates on the central nervous system along the spine. Will close off the gates that the pain needs to travel through in order to get to the brain to perceive the sensation. So basically, we have survival instincts that say it's more important for us to be able to, flee, fight, flight, than actually feel the pain. So to activate these gates in this pain theory setting, we need to get active, or like moving around in labor, or have the touch massage in order for them to become effective. And this thought or this theory came from Ronald Melzack and Patrick Wall in 1965, who were the first to really revolutionize the prior really simple understanding of pain as just kind of associated with the degree of the pain and the stimulation and the damage of the tissue equals the pain that one feels. And they recognize that it's much more complicated, complex, and beautiful, and that it's also based on emotional and thoughts, as well as other sensations the body's feeling. So the idea is the pain must go through these neurological gates of the spinal cord in order to reach the brain. So when these gates are closed, the pain is felt less or even not at all. Rubbing, as we talked about, helps to send that sensation along a larger nerve fiber at a quicker rate than the pain itself, and closes the gates. So the physiology of this is that we have our peripheral nervous system, which is different parts of our body, and our organs are connected to the spine and the central nervous system. And the peripheral nervous system recognizes pain, temperature, pressure, all these sensations, and then sends them to our brain. And when the pain is experienced, it gets conducted along this nerve path to give the intensity of the pain. But as I'm explaining, it can be secondary to these other non-pain signals. So when the non-pain signals are greater than the pain signals are blocked or reduced, and the pain is not perceived. And for childbirth, this is really relevant because childbirth is really intense. And it's been shown that TENS, the electrical stimulation machines, can help reduce the pain. The sterile waters, as an acupuncturist, different acupuncture techniques, acupressure, even like hip squeezes, massage, hot, cold, all these kind of comfort measures that we do in childbirth that we see work are actually scientifically relevant when we learn about the nervous system. So it's pretty cool to think it's not just like a placebo effect, but that it's actually happening in our neurology, and different effects are going to be more effective for different people, but that it's really exciting that we can really see how important our comfort measures are in helping our clients cope with the pain, so they can experience some of the inherent oxytocin and bliss and opening and pleasure and safety that are also inherent in birth, as inherent as the intensity and the waves of pain. So yeah, I love this theory. It's really helpful to know about and to teach our clients.